Scenario: lecture at a community hospital medical staff training. Title: Eponyms in Clinical Practice, Clarifying the Language of Care. Presenter: Dr. Maya Elston, internal medicine physician and medical educator. Audience: mixed group of healthcare providers, physicians, nurses, physician assistants, and medical interpreters. Scene opens in the hospital conference room. Dr. Elston is standing at the front of the room with a PowerPoint projected behind her titled, Eponyms in Healthcare. Helpful or harmful? Dr. Elston: Good afternoon, everyone. Thanks for joining today. We're going to talk about something we all use often without thinking twice: eponyms in medicine. These are the terms named after people: Graves' disease, Parkinson's, Apgar score, you know the list. But let me ask you this. How many of you have had a patient look confused or even scared when you mention one of these terms? About half the room nods or raises a hand. Dr. Elston: Exactly. While eponyms are second nature to us, they can be a barrier for patients. They often carry no clear meaning unless you know what they are. For example, if I tell a patient, we're testing for Addison's disease, what does that mean to them? It's just a name. There's no hint that it involves adrenal insufficiency or why they feeling fatigued and dizzy. She clicks to a slide with a photo of Thomas Addison and a patient confused by the diagnosis. Dr. Elston: Now imagine that same explanation with more descriptive language. We're checking if your body is producing enough of a hormone that helps with blood pressure and energy. There's a condition called Addison's disease where the adrenal glands don't work properly. That could explain your symptoms. See the difference? Another slide shows a table comparing eponyms with plain language equivalents. Eponym: Parkinson's disease, Crohn's disease, Cushing's syndrome. Dr. Elston: I'm not saying we stop using eponyms. They're part of medical culture and useful shorthand in clinical settings. But we need to translate them for our patients. If we say, he has a positive Babinski sign, let's follow it up with, that means his nervous system might not be working properly in one area of the brain or spinal cord. She pauses and adds, and for our interpreters, this clarification is crucial. Not all eponyms have direct translations. So when we explain them clearly, it helps both the interpreter and the patient. Final slide reads, communicate with clarity, translate the eponym, empower the patient. Dr. Elston: Let's keep using our rich medical language, but let's not forget who we're talking to. Patients deserve to understand what's happening in their bodies. And that starts with clear, compassionate communication. Audience claps. Several providers stay behind to ask about creating handouts with plain language explanations for eponym-related diagnoses.